But welcome to the Cognitive Rampage tonight. I know you may be waiting on the lesson or the Cognitive Rampage lesson that I would normally do. I'm going to forego the lesson tonight. I got a lot of emails over the last couple of weeks about people. They're trying to ingest what's already been put up right now. So I don't want to keep flooding information. So I'm going to let the lessons that are out there marinate for a while on the channel and let people process those for a while. I'm answering back and forth a few emails. What's up, Leo? Answering a few emails back and forth with a couple people asking questions. So if I haven't got back to your email yet, I apologize. I'm working on it. I'm doing a lot of things. Got a lot of plates spinning, as you know.
Yeah, we sure do.
Probably too many plates. I mean, we're getting so close, but I feel like, with MyWindowOutcom that's coming out, and I feel like it's like every 2 weeks we're supposed to go, live. Every 2 weeks supposed to go live. We're just testing that site. For those of you that don't know, MyWindowOut.com is a website that myself and two other partners are launching soon. But anyway, it's a social opportunity site for people with chronic pain, chronic illness, and disability. Essentially, you can create a profile. What's cool about it, man, is you can actually search for people based on their diagnosis. So you can find people that way. We got some interactive shows and things that are going to be on it.
Yeah, fantastic. I mean, it's a research. There's nothing out. I mean, there's other sites, but nothing compared. I mean, what you're doing is something that's needed internationally.
That's what we're hoping, man. I mean, we started the website really just because people need the help. That's Dr. Jan Burt is one of my partners. He's a consultant, I should say, onto the project, not a partner. But he sees chronic pain patients. That's his specialty as a clinical psychologist. And this just doesn't exist. A lot of people dealing with chronic pain, chronic illness, they just they tend to stay away from Facebook and
they isolate themselves, and they try to take control where they can.
Yeah.
And so they try to then control what's around them, their environment. But then the only way to feel totally in control of that is to put yourself in total isolation.
Mm-hmm.
And then there's a tendency to think too much.
Yeah.
And most studies show, pain up to 80% is emotional. It's what you're thinking. So that mental aspect, they tend to dwell on the negative aspects of who they are and not celebrate the positive aspects that they could actually be.
Yeah.
And this site then tunes them into that.
Well, that's what we're trying to do. We're trying to get on. It's my window out. We're essentially trying to, use
what's outside
this.
that window.
It is. We're trying to almost use it as a launch pad to help the people suffering or dealing with these things, to get back out into life and kind of launch again. And the window's just your way out.
Oh, yeah.
To get back out in life. That's why we're doing those interactive events. We'll be broadcasting on there. But, people we have about 40 or so diagnoses that we're going to put on there.
And that's people should know it's not meant to be like a dating site.
No, it's not a dating site. No, that's not what this is at all.
This is, okay.
It's I appreciate you clearing that up. It really is. It's a social opportunity site is what we call it. A place to be social. And what we actually have on there on the website now, it's not up yet, so don't go to MyWindowOut.com. That's what we're talking about. We're 2 weeks and then maybe 2 more weeks, but we're in development right now. We're very close to a beta launch, but we found that in research there's an interesting article that our consultant Dr. Jan Burt has published that's going on the website. How the research shows that socializing, even virtually, helps with chronic pain, illness, and disability, and doing things like that.
Well, any kind of distraction.
Yeah, and to a point, it's a distraction like a game might be, but when you start involving people's lives, and sharing, if I can contact a patient that's dealing with what I'm dealing with, I say a patient because I'm clinical from where I'm getting out of, but I should say a person. If I can contact another person that's experiencing what I'm experiencing, they may have advice my doctor doesn't have. Try this, try that. If you sit this way a little bit for longer, sometimes this stretch works for me. Just the information, to be shared between the patients, the people about what they're experiencing.
Oh, yeah.
And what's cool is you can create live chat rooms, about any topic you want to. You can actually do if I'm a member, I can create a chat room and I can invite people to a live broadcast that I do from where I'm sitting.
And what's really cool is like in any group where you can't get this out of any other kind of intervention or therapy, but in a group setting, I mean, when they're in that chat room, when someone on that other end of that chat line says, I know what you mean, they really do know what you mean.
That's right.
And there's nothing more infuriating when no one can relate to what you're going through. And they say, yeah, okay, yeah, I know what you mean. They don't, and it's infuriating. But what's cool is by able to suggesting something to that person that's coping with that specific type of pain, that in a lot of ways it helps them just enough where they can get past that window and get out there and realize that, you know, let's say 10% of their life is pain, but you don't want to give that 10% 100% of your focus.
Yes, exactly.
And by getting into that 90%, by really tapping into things that have become dormant, I mean, where they evolve from that is pretty amazing. And that one person that they gave a little tip to, they realized that maybe there's a purpose for going through this pain. Because had I not gone through this pain, I couldn't help that person.
That's right.
So,
I mean, we have a part of the website. They have share your story.
Yeah.
So we're collecting different stories that people are going to share. One of the shows we're going to do, I mean, we're actually creating a network, if you will, My Window Out Broadcast Network. And so we'll have multiple shows on this network. And one of the shows is a docu-series, docudrama series we're creating with a member per month. You know, and so the members are submitting their story and then what they're doing in their life currently. And essentially, it's kind of like a fantasy we're going to let them live for a day. But we're going to kind of walk them through what My Window Out has done for them. A real optimistic view, reality show, if you will, following someone using MyWindowOut.com, experiencing chronic pain, illness, and disability, and, you know, hanging out that month with them. So each week we're going to air an hour show following this member, and we're going to select a new member each month to do that show on. But you know what we are doing, you know, I'm sure you may know some people, and for anybody listening, is we're looking for 200 charter members dealing with chronic pain, illness, or disability, or also being a caretaker of someone experiencing those things, or even a practitioner in the field. And we want them to create a profile. We're going to do some charting, some following, those kind of things. But we say charter member because they'll have a lifetime membership for free, full usage. You know, and it's free to create a profile. That's free. You know, there's different levels, but you know, so if anybody interested that's watching knows somebody taking care of somebody or is somebody with chronic pain, illness, or disability, or is in the field in that area, please email Adam at MyWindowOut.com, and I'll be more than happy to speak with you. I'd love to possibly make you one of the free charter members.
I mean, it's an amazingly important thing you're doing. I mean, because it's not just removing them from the focus of their pain, it's helping them rediscover who they are, their own sense of identity. Because so often when you're dwelling on the pain, and by telling people I'm in pain, you're defining yourself as being in pain.
As the situation.
Yeah, that becomes your identity. I'm in pain. No, you're being affected by pain. It's an aspect of who you are, but it doesn't define who you are.
Same thing you were talking about on your show earlier tonight. Is separating the situation